You start.
Yeah. Good afternoon, everyone. Today I'm going to present my topic on post-traumatic endophthalmitis and the trends changing. And I would like to thank All India Conference for giving me this opportunity. Post-traumatic endophthalmitis comprises around 25 to 30% of all cases of endophthalmitis, and the clinical course and results are dependent on various factors that has been listed by the Cohen et al. In an ocular trauma score, and he has defined that lesser this score, poorer is the prognosis. And there is a role of intravitreal antimicrobials in the treatment of any category of endophthalmitis. And the most common regimen that we use for the bacterial endophthalmitis is the vancomycin and the ceftazidime combination. And for the fungal endophthalmitis is usually the voriconazole that we use. But way back in 1999, Zelali et al. Has reported the increasing resistance for the ceftazidime and also a little resistance to the vancomycin. So with this basic background, we have planned this study to find out the causes and specifically the traumatic endophthalmitis and their causative organisms, and to find out the antibiotic susceptibility and the resistance pattern. And it was a retrospective study in which we have analyzed 46 patients of post-traumatic endophthalmitis suspect, and we have done antibiotic sensitivity with Kirby-Dish diffusion method. Most of the patients were younger age and the males, and the mean duration since trauma was 10 days, and 76% patients presented within 1 week. Presenting vision was very less from the perception of light to 1/60, but the final visual outcome in our set of patients was good, around from more than 20/200 to more than 20/40 was we have achieved as in 41% of the patients. But we have also found non-perception of light in two patients, in which one patient was eviscerated, in which we have found a mixed organism growth. And if we found about the culture reports, 22 cases were culture proven, out of which 50% were the gram-positive bacilli, and the most common organism that has grown was the streptococcus and the pseudomonas, as far as the gram-positive and the gram-negative were concerned, and the aspergillus was the most common fungi that has grown. It has been reported by Jalali et al. Also. And if we talk about the resistance for the empirical regimen, we have found a surprisingly very high resistance for ceftazidime that has reached up to 75% in our set of the patient. And this trend of increasing resistance we have found since 2016 to 2018. And this is the most alarming factor that we have found in our series, that one patient which has grown for the Proteus was resistant to colistin. This is like and if we talk about the other patients, so we have found resistance to iron antibiotics. The resistance to gram-negative organism has already been reported by several authors, including the ceftazidime and the vancomycin, but more for the ceftazidime. But the resistance for higher-end antibiotics has never been reported except for the systemic antibiotics. So maybe future studies will be required to validate our findings. So just to conclude, the most common isolated organism in post-traumatic endophthalmitis is the gram-positive organisms, and the antibiotic resistance and susceptibility pattern is changing, specifically for the ceftazidime. So maybe in the future we need to change our empirical regimen, and the higher-end antibiotics should be kept for the reserved cases. Thank you.